Hello, I'm Dr. Jackie Montefiore here from Sante Medical, and I'm joined today by our functional medicine doctor, Dr. Ravi Gornal. So thank you for joining us, Ravi.
Welcome.
Yes, so we wanted to have a bit of a conversation today about functional medicine. What is it? Where can it help? So far away, what is functional medicine, Dr. Rav?
Functional medicine is trying to identify the root cause of what is the person's complaint or the patient's complaint, so they can come with a certain issue and rather than say, well, let's fix that issue with XYZ, we'll say, well, what's causing that issue?
Sure.
And once we can find out the cause of the issue, we can then try and get to the root of it and fix it that way, so kind of back way up as opposed to just plastering over the hole and hoping that it heals. So
over the symptoms.
Exactly. So kind of trying to say, well, what's causing the problems in the first place? So is it a gut problem? Is it a hormonal problem? Is it just a lifestyle problem?
Yeah, sure.
And that's really the main work that I do. So just to kind of identify what it is first.
Yeah.
Before we go and try to fix it.
So let's give an example.
Mm-hmm.
So say someone came in to see me as mainstream GP trained, as are you also initially.
I am.
So
yep.
someone comes in with like a patch of nasty eczema.
Yep.
So, I would tell them to avoid long hot showers, try not to have the skin dry out too much, really meticulous moisturizing, and then some steroid cream to try and dampen down that immune response.
Mm-hmm.
And I usually like to just hit it hard and fast with some Advantin or something like a strong steroid just for a short duration to settle it down. So that would be a mainstream medical approach, and obviously using that approach, it potentially could re-flare up again from time to time. So then if we looked at that condition, eczema, from a functional medicine approach, how would it differ?
So this is where I guess it's a really good example actually, where there is a big change. So if I see a patient with eczema, I'm instantly concerned that there's a lot more going on behind the scenes. I often say to people that the skin is a window to your health, really. So it's the largest organ of our body. Yeah. And something is causing that eczema, and very rarely is it just because of a contact or a moisture issue, or a lot of people get contact dermatitis on their hands, for example, after using detergent, but not everybody does. So why do some people get it and some people don't? It's not the problem of what's triggered off the eczema, it's your reaction to that trigger as to why are you getting eczema. So I treat eczema almost like an autoimmune disease essentially, and I would start with trying to identify what could be triggering this patient's immune system to cause their skin barrier to be affected, giving them the eczema rash. So my approach would be, first of all, taking a very, very thorough history. How do they eat? How do they live? Do they have any other symptoms? Because quite often it's not just one system that's affected. Are they also getting bloating and diarrhea or constipation or irritability or low mood or things like that? Because there can be a lot more going on. And then depending on what I get from the history and where they are in their journey, if they're very new to it, they've just got the eczema, or if they've had it their whole life and they've tried a million things, it affects what I would prescribe in terms of the treatment or investigations that we do to find out further what the cause is.
Yeah, absolutely. And I really love your approach, Dr. Ravi, because it fits in so well with the rest of our practice. So as you know, we're a GP practice that has a food first approach to treating our patients, and preventative care is a very strong pillar of how we do that. So, but sometimes that can only take people so far. If they feel like they've maxed out with optimizing diet, sometimes in that situation will be where I'll suggest someone come along to see you, because I wonder if there is a deeper dive that needs to happen to look more into underlying issues that my training doesn't allow me or doesn't equip me to look into that depth. Is that a pretty fair?
I think that's really, really fair. I mean, even with what I do, until I feel like the diet and lifestyle factors have been addressed, I'm not going to do any fancy hundreds of dollars of tests unless I really think there's clearly something going on, or this is straightforward. But the same being said, if we take the eczema example, somebody goes, and I really heavily use an ancestral approach to the way that I manage disease, I will always use a paleo type diet. A lot of my patients start with a paleo kind of reset, and let's just say somebody with eczema starts a paleo reset, a month later their eczema is gone.
Yeah.
We would then work with a reintroduction, say, okay, well, what did you take out that could be the trigger? If it was dairy, for example, which can be a common trigger for some people, why are they reacting to dairy? That isn't, once again, is it the dairy's fault, or is there a gut permeability that's allowing these proteins to then enter the bloodstream? So then we kind of work on, well, do we need to heal the gut? Is there a overgrowth of bacteria in the small bowel? Is there a imbalance of bacteria in your colon? Do you have a parasite or something in the gut that's causing that? So we can get caught up in a bit of a trap, and this is probably what brought me down this functional rabbit hole of, yes, okay, I can get you to restrict your diet for a very long time and your symptoms will improve, but have I really treated the root cause? Sometimes yes, sometimes okay, if actually you are so inflamed from a standard Australian diet and we put you on a paleo type diet and you get 6 months of really good healing, that permeability may have healed because your trigger could have been junk processed foods, which, you know, okay, we didn't need them in our diet anyway. But if your trigger is, you know, if some people are really sensitive to nightshades and nuts and seeds and simple whole foods, which are generally should be a healthy food, maybe there's something underlying that's making them a bit more susceptible to that, and we can work on it. So there's two schools of thought. So you can kind of speed up the healing process by finding out whether there is something contributing to it, or allow them a lot more time to heal on a specific type of diet. But I do start with food, sleep, exercise, movement, human connection. You start with all the core principles, and then go a little bit further depending on where that person is in their journey.
Yeah, that sounds good. And it's interesting, you mentioned it with allergies. Sometimes people will get some allergy testing or whatnot, and or they, you know, they think, oh, I don't tolerate eggs, for instance, and they feel like that's set in stone. And I'm often trying to broach the possibility that maybe if things heal in the gut, for example, potentially your tolerance to that particular food could change. So it could be a fluid process over time. With that
and with that, I don't massively test everybody for every allergy. I mean, some people could come up red for everything. That's just a small bowel permeability. And then we've got to start somewhere. So no, I start with generally, like with the paleo type diet, it does take out some of the obvious triggers. Sometimes we have to go a little bit more further with that, but often, yes, you should get to a point where you're healing and you are able to tolerate a lot more. Like I said, maybe not junk food, but you should be able to tolerate things like eggs and stuff if we can get you healed.
Definitely. Excellent. Sounds great. Well, thank you for that overview, Ravi. So Ravi's appointments are a bit longer because she mentioned she goes into that deep dive, so she gets this thorough questionnaire to be completed beforehand. It goes through that in depth. So if you're interested in coming in and seeing Dr. Ravi and going through things to do with your health in a bit more depth, go ahead and make an appointment and she'd be happy to help you out.
Definitely.
Excellent. Thank you, everyone.
Thank you.
Bye for now.
Bye.